Well, today, Dr. Chris Baker here, I'm going to talk about sex and orthodontics. I'm going to tell you sex and orthodontics, said the madam. You're probably going to wonder what in the world I'm talking about, so let me just give you a little clue and then I'll explain it to you. First of all, just so you know, beauty, attractiveness is a very, very important part of who we are, how far we get, what people think of us, what career we can go to, what success we will experience. Being attractive, being beautiful carries you. And so what I want to explain is that there are some other things about it that you may not know that are absolutely astounding as you work to give people beautiful smiles. Orthodontics in particular, but of course there are lots of other ways you give them beautiful smiles with veneers and other cosmetic treatments. So I'm just going to stay on the orthodontic topic today since that's my love and my passion. I want to tell you that the Surgeon General in the year 2000 did the annual report on oral health, which you may or may not know. And at that time, he said the beauty of the face as the bearer of identity, I'm going to get this just right, character, intelligence, and beauty is universal. Someone's face tells the world how intelligent they are? Yes. Actually, studies have borne that out. We're talking scientific studies. We're not talking about something that encourages you to judge. We're talking about something that shows that people believe beautiful people to be more intelligent. That's almost absurd when you think about it, but the reality is that's what we have found to be the case. Now, you also may know, of course, when you think about it, that faces that are judged ugly or disharmonious are often associated with defects in character. In other words, someone with a cleft lip, poorly repaired, or someone with part of their nose misshapen from an accident or surgery or who knows what, will be considered possibly to not be as capable as someone with a beautiful face. So this is why it's so important to understand what you're doing for people. But even, listen to this, school teachers have been shown in very many studies to evaluate their students as much more capable if they're pretty little kids, if they're attractive. They assume them to be capable. Can you even imagine? But it's true. Think of what you do. You can transform the lives of patients. You can change everything for them. You do day to day. Now listen to this. Let's get back to sex here. Attractiveness has been shown to reap people more sexual partner choices. Yes. It has been shown that attractive people marry others with greater education, with greater incomes. This is amazing, but it's true. It is absolutely true. Attractive people get better jobs. They get higher salaries. You know, they talk all about the glass ceiling and women and whatever. Let me tell you something. Attractiveness is much more a player in all of that than anything having to do with gender. Let's get back to sex and orthodontics. It's the beauty, folks, that makes the biggest difference for people in not only what job they will get, what career they will go into, what success they will have, but also how much money they will make and what sexual partners will be attracted to them and they as well. Let's see. Again, I told you their salaries are higher. That's a biggie to me. Attractive men and women are treated preferentially not only by teachers, by coaches, by bosses, by the world, by people. After living in the United Arab Emirates, it has become very evident to me how they perceive there that Westerners, including us lucky Americans, are perceived to be somehow more special. Now, I can't tell you exactly why that is. It comes from many generations of experiences in different cultures, but beauty of being a Westerner is considered more so than not. So beauty in the eyes of the beholder is a really amazing thing. And you have the opportunity to give your patients the most beauty possible in their smile, which is a big part of their beauty, obviously. The other thing I wanted to tell you is that think about all of the different actresses, actors, Hollywood types, I guess we could say, who go and have all kinds of cosmetic dentistry done, who have facial augmentations done, who have things done to make themselves more beautiful. Those are just an example of how they get better careers, better jobs, you see. Okay, so what are you doing to help your patients? You're giving them a beautiful smile. You're giving them the opportunity for straight, pretty teeth. You're giving them the opportunity to have more sexual partners. Yes, sex and orthodontics. And by the way, I'm the madam, Dr. Chris, signing off.